So they can see. Act like y'all like each other. Thank you, Rick. All right, everybody, good morning. Thank you so much for coming today. I want to welcome Dr. Claudia Regal, who is the Director of New Orleans Mosquito and Termite Control Board, Dr. Jeff Elder, who is the Interim Director of the New Orleans Health Department, Dr. Parham Jaberi, the Assistant State Health Officer, Louisiana Department of Health, and Councilmember James Gray, along with other individuals that have joined us for this press conference today. First of all, as always, public safety is our #1 priority, and our Office of Homeland Security and Emergency Preparedness is now monitoring Tropical Storm Earl. For those that have been paying attention, this is a system that's currently located off of the coast of Honduras and is moving in a west-northwest direction. It's likely going to strengthen into a low-level hurricane prior to landfall in the southern Yucatan Peninsula, but there is no threat to the city of New Orleans. However, we are going to continue to watch this system very closely. We're in the middle of hurricane season, and I just want people in New Orleans to be aware that there are potential threats, but we will continue to monitor and advise as we go forward. But as of this time, there are no threats, and we don't expect a threat from this particular system. Secondly, I want to talk about Zika. A couple of months ago, I went to Congress and I testified in support of President Obama's request for $1.8 billion for emergency funding to respond to the Zika threat that is threatening not only some areas in the United States, but South Central America and other parts of the world. We consider this to be a very serious threat, not something to panic about, but something to be prepared for. As we all know, Zika is spread through mosquito bites. It can be most specifically spread from a mother to her fetus during pregnancy and cause serious birth defects. You've heard the term microcephaly. And that is something we want to make sure that we stay way ahead of. It has been in recent past affecting South America, Central American, and Caribbean countries. But as of last Friday, for those folks that are watching the national news, Zika virus transmission by local mosquitoes has been confirmed in the Miami-Dade area of Florida. So people immediately will understand that Florida, Georgia, Alabama, Mississippi, Louisiana, all of our areas are susceptible to this particular virus. The CDC has advised that any women who are pregnant or trying to get pregnant postpone travel to any area where the Zika virus and transmission is ongoing. You may have seen some of the stories about the Olympics. That holds true for all of us. We consider this to be an extremely serious public health threat that we just make sure we take precautions for. Today I stand here with local and state officials to talk about our own preparedness in the city in the event that Zika virus occurs in New Orleans. You may remember that we had a press conference many months ago beginning to prepare people for this. I then went to Congress. We think it is appropriate at this point in time to have another event so that people can start paying attention. So today I stand here with all of these individuals, and I just want to emphasize for the public that we want people to be prepared, but we don't want anybody to panic because there's no reason to do that. At this time I want to emphasize that there are no locally transmitted cases of Zika virus in New Orleans or Louisiana. However, there are 17 travel-related cases around the state and 9 in the New Orleans metropolitan area. Our mentality should not be a matter of if we will face a locally transmitted case, but rather when, because it is likely that we're going to have one. So in New Orleans, we know the importance of emergency preparedness, and like much of the southern United States, we are home to both of the mosquito species that transmit the Zika virus, and that's why we continue to take this very seriously. Today I am authorizing an expenditure of $500,000 more to the inspectors, for insecticides, for equipment, to aggressively target the mosquito vectors. In simple language, this is for much more aggressive spraying in and around New Orleans. In March, we released our comprehensive plan in partnership with the Center for Disease Control, with Tulane and the state, to address the Zika virus. We launched a very aggressive education campaign to educate physicians about the Zika virus, and a proactive public outreach campaign so that people of New Orleans understand how to protect themselves. And we are literally have our teams going door to door to communicate with individuals about how to be better prepared and how to protect themselves and their homes. But like anything else, those of us standing around can't do this by ourselves. We have to have the public help us as well, and there's some very simple things that the public can do to make sure that you are less prone to be in harm's way. The first thing that you can do is to today and at least once a week begin to protect your home. You have to do this by eliminating standing water, by dumping and or cleaning out containers around your home at least once a week. All of us have this in New Orleans. There's a lot of rainfall. We have a lot of things that capture water. You have to get rid of that because that is where mosquitoes fester and grow. Disposing of trash and clutter, specifically like old tires, would be very helpful. Cynthia Sylvain-Lear is here from the Department of Sanitation that will tell you that we will actually take at least 4 tires away from you. If you have old tires in and around your house that collect water, put them out and we'll pick them up to the tune of 4. You want to scrub your pet dishes and bird baths before refilling the water, and you want to ensure that your window and door screens are in good repair in order to keep mosquitoes from getting inside. You also want to wear mosquito repellent when you're outside. You want to limit your outdoor activity from dusk till dawn. Wear long sleeves when you're outside. And if you don't have air conditioning, sit in the airstream of a fan. These are things that a lot of people in New Orleans can do very simply to limit any possible danger or exposure that we have. In the meantime, our team is going to be out and about doing as much spraying as we possibly can and help people understand how to clear their neighborhoods from the possibility of mosquitoes actually growing and festering. The first thing that we can do is prevent mosquitoes from actually coming, and in order to do that, you have to clear the environment that is hospitable to them. So we're going to do everything that we can, but we also have to have state and federal resources to sustain this aggressive response. We need to have continued communication between our federal, local, and state partners, and they're all here today. We will continue to do that, and I want to again re-urge Congress to do their job and to make sure that we have this emergency funding that the Center for Disease Control has requested for some time. That request has been in Congress now for many, many, many months. Mosquitoes don't really respect political parties, and they don't respect Congress's timeline. They're kind of out and about and doing what they do, and we would like to ask our federal partners to do the same so that we can get to work and protect the people. In the meantime, we're moving ahead with a $500,000 allocation to Dr. Regal and her team to make sure that they really double down on the amount of spraying that they do. And again, I want to reach out to the public and ask them to help us, help them, by making sure that they clean up their properties and make it much less likely for the mosquitoes to have an opportunity to do the damage that the Zika virus has done across the water and now in Florida. So with that, I thank you all. I want to call up Dr. Claudia Regal to make some comments, followed by Dr. Jeff Elder, and then Dr. Jaberry, and then have the City Council members make comments at that time. Dr. Claudia Regal. Thank you.
Thank you so much. Thanks, Mayor Landrieu. I really appreciate the commitment of our city towards mosquito control. It's incredibly important. And I want to let most of you know, all of you know what we're doing and have a better understanding about the 2 mosquitoes that can transmit the virus. But they're called Aedes species, Aedes albopictus and Aedes aegypti. Aedes aegypti is a yellow fever mosquito, and that's the predominant mosquito that has the ability to transmit that virus. It's active during the day, but also at dusk and dawn, they're active here as well. So just make sure that you're wearing your mosquito repellent, that you're wearing the long sleeves, protect yourselves from those mosquitoes. They love to be in and around your home. So they are container breeders, both of those species. And so again, thank you so much for reminding everybody you really need to take the time and look at all those little containers. It does only take a bottle cap, a top of a lid of a bucket, for example. We've seen many situations where you've got breeding there. It's very important. You know, we're at the peak of the season right now. So we're in August, beginning of August, but And we've been on top of this since the beginning of the year. And so really from April to November, that's going to be really your season. It cools down, and that's going to give us some relief, but the reality is it's warm all the time. And so you can never forget about these mosquitoes. So we do have a comprehensive program. We've actually increased the number of traps throughout the city to help us get a pulse on what is going on and as far as numbers and where these mosquitoes are located. Very aggressive door-to-door campaign. Our department, the New Orleans Health Department, we've had many, many volunteers that have come in and helped put this information out. The state has also provided information and handouts that we're using. And in fact, in your water bill, if you have not received it already, you're going to have a small insert that talks about the different types of containers that are out there, what to look for, the life cycle of a mosquito, which right now, from egg to adult, it's about a week, so pretty important. So a couple of the containers, I'm going to just focus on containers if that's okay, because it's saucers. That's the number one thing that we see in our environment. So it's raining a lot now. How about turning over those saucers or removing them? It's just really that simple, and that's going to help us out a ton. Buckets is a big one. Just general clutter with plastic. Think about your grill cover. A little bit of water there is going to hold that, and that's enough that you need. All right, so just sort of to reiterate too, what can you do? Again, once a week, I like to pick a garbage day, maybe on your first collection, walk around your property and really pay attention to the details. And it may even be that bromelia that you have that's holding water. Some of the plants, they hold water. In fact, this week, I saw one that was really breeding quite a bit. So very important to turn over those containers. And of course, you can always call our office. You can call 311 if you have any questions, if you need us to do a yard inspection, if you have a pool or a pond, a hot tub, please call us because we have the capacity to help you out with that. So very, very important. And again, please look at the CDC website, use an EPA registered repellent. These are very important. They do list different options for you, and just to really continue on. So again, just to thank you again for having this, and thank you for the additional funding. We are going to be going more door to door. We are going to be doing that aggressive program. Also, if you have a loved one or a friend, that perhaps is deceased in one of our cemeteries, if you're not using the inserts and the vases that are in those cemeteries, please remove them. It really does help us out a lot. The cemeteries are holding a lot of water. We've been addressing many of our city cemeteries by filling them with sand, by removing the inserts, but we're asking everybody to do their part. So again, thank you.
All right, Dr. Jeff Elder, New Orleans Health Department.
Good morning. The New Orleans Health Department has been working with the Louisiana Department of Health, the New Orleans Mosquito and Termite Control Board, and other partners to ensure that the city is well prepared to mitigate and respond to any threats of the Zika virus. There have been 17 travel cases of Zika in Louisiana. However, there are no locally transmitted cases in the state. We're asking that you take this threat very seriously, and it's important that everyone does their part. Working with our partners, we've developed a comprehensive plan that includes intensive mosquito control efforts, a public education campaign, and along with a response to travel and, if necessary, local cases of Zika. We're currently conducting door-to-door outreach and yard inspections to show residents where standing water is collected in their yards, so don't be surprised to see us out there in the community. Additionally, we're working with local healthcare providers to make sure that they're identifying suspected cases and connecting with the Louisiana Department of Health for proper testing. Information is available on our website, www.nola.gov/health, or by calling 311. You can report any areas of mosquito control concern to 311 for investigation. Finally, just a few recommendations. As Claudia said, we need everyone to check their yards for standing water. The sources should be dumped, drained, cleaned, removed to decrease the mosquito breeding population. Everyone should use insect repellent or wear long sleeves to protect themselves from mosquitoes while out and about. And travelers to any Zika-affected countries or to the Wynwood area of Miami, Florida, should view travel guidance on the CDC's website, www.cdc.gov. Wear insect repellent for 14 days after you return from your travel, use condoms, and visit your doctor if you have any symptoms or develop any concerns regarding Zika. Thank you.
All right, Dr. Jabari.
Good morning, I'm Dr. Parham Jabari, the Assistant State Health Officer with the Louisiana Department of Health. On behalf of the Department and Secretary Gee, I would like to recognize and thank you, Mr. Mayor, for having this press conference. Educating our residents about the risks of Zika transmission is a most critical and important step in protecting our community. Last week, we learned of the first locally transmitted cases of Zika in the continental United States. While at this time we have no locally transmitted cases here in Louisiana, we do realize there is the potential possibility. The Louisiana Department of Health has been involved in Zika planning efforts since this issue began for us and gained national and international attention at the beginning of the calendar year. Our efforts at LDH have been aimed at conducting surveillance and tracking of Zika cases. This is done through the Infectious Disease Epidemiology Office of the Office of Public Health, headed by Dr. Raul Retard. We provide technical guidance to healthcare providers, to primary care physicians, OB physicians, and any other folks that may need it. We work with local officials, as we are here today, and community partners to educate our residents regarding risk prevention strategies. You've heard them repeated over and over again today, to go ahead and dump those containers lying around your home, your workplace. We want to get rid of any stagnant water sitting near our properties so we avoid the mosquitoes from being able to breed. Use insect repellent, and we also want to make sure you wear long sleeve shirts, pants. Of course, weather is a challenge here in Louisiana in the hot summer months, but to the point possible. The idea is to prevent the mosquito from biting you. This will not only prevent you from getting the illness, but in the event you have been infected by the Zika virus, this prevents the mosquito from becoming infected and infecting others as well. We're working closely with mosquito control authorities and mosquito abatement districts around the state regarding areas for spraying. In the event that we have a cluster of locally transmitted cases, we will intensify surveillance for human cases in those neighborhoods by conducting door-to-door outreach campaigns and alerting local clinicians. The geographic boundaries determining the areas of Zika transmission will be set by our state epidemiologists, state entomologists, in conjunction with the New Orleans Mosquito and Termite Control Board. In addition, we would encourage pregnant women to be tested if they are living in an area where there is local Zika transmission. For right now, and as we plan for the future, it is important to remember that the Zika virus is of greatest threat to pregnant women, and this is because of the infection that can be passed on to the infants, resulting in potential fetal death or severe birth defects, as the mayor had alluded to earlier. Pregnant women and couples trying to get pregnant should avoid travel to areas with Zika transmission. That list is provided by the CDC, and we want to make sure we update our residents with potential areas in the United States which may also have local transmission. Because Zika can also be spread through sexual contact, safe sex practices, including the use of a condom and or abstinence, is also encouraged. The Louisiana Office of Public Health Infectious Disease Epi Section and our staff here based in the New Orleans office, Region 1, will continue to work hand in hand with the New Orleans City Health Department. All recent Zika infections amongst Orleans Parish residents and the surrounding areas will be reported to the appropriate mosquito control authority, and here in New Orleans, the City Health Department and the New Orleans Mosquito and Termite Control Board. We will continue to work collaboratively with all of our partners, with the Mayor's Office, with the Office of Homeland Security and Emergency Preparedness, and everyone else in our communities to ensure that we are able to protect our citizens against the Zika virus. Thank you for your time.
All right. City Council.
Good morning. Thanks to the mayor and to our state and local partners